Dr. Heather Bernard now joins us from the Infection Prevention for MVHS. She's the director from MVHS. And thank you for joining us. I know you guys are very busy right now. The first thing that we want everyone to understand is what restrictions are in place when it comes to MVHS.
Yeah, MVHS, we have visitor restrictions in place as well. We are allowing one visitor at a time to our inpatient units, and patients under the age of 14 and under are not allowed.
We wanted to talk to you not only as somebody who's taking steps within the hospital, but maybe somebody who could also help the rest of us stop the spread of the coronavirus. So when you're talking to your staff, when you're talking to the nurses, the doctors, people visiting patients if they're allowed to, if they fall under that category, what measures is the hospital taking? Are you posting signs? Are you putting up more soap dispensers? What is MVH doing?
Yeah, so we do. We have signs at our entrances. We're working to limit our entrances to be able to screen people to make sure that we don't have anybody coming in sick. We have masks and hand sanitizer at the entrances, and we're doing a lot of education and preparation for an influx of patients.
Over the last few days, how many times have we said this? Don't just show up at the emergency room or urgent care. So if people are showing symptoms, what would you advise?
So if you're showing symptoms and they're mild symptoms, I would suggest calling your primary care provider to get some direction in terms of what should they do. Because it's important to evaluate the risk of exposure to coronavirus so that we can determine whether or not testing is needed. If somebody is experiencing severe symptoms, then they should go to the emergency department. But we really are trying to preserve our healthcare resources for those sickest who need the emergent care.
The other thing that we continue to emphasize is that if you are feeling healthy and fine, you need to continue to do the simple hygiene things so that you stay that way, correct?
That is absolutely right. So, you know, we've talked a lot about quarantine, we talked a lot about social distancing, and it is important for us to stay away from people who are sick and make sure that if you're sick that you stay at home when you're sick. You know, all those things that we were taught when we were in kindergarten. You know, wash your hands, don't touch your face. All of those things are incredibly important right now. I think that this is where the rubber meets the road,
right.
You know.
Yeah.
I think it's one of those things too, we don't realize how much we touch our face, and we're told don't touch your face.
Right.
I'm
then
all day long, I'm like, don't touch your face.
And then you really need to, all of a sudden.
Right.
No, you have to stop.
Doctor, thank you so much for coming in. Again, MVHS, along with Rome Memorial, we talked to Bassett, all restricting visitors at this time, taking steps to stop the spread of coronavirus, and we are going to continue to cover this, what's become crisis, as these developments change. We are seeing changes not only day to day, but hour to hour. So we thank you for coming up the hill and advising us.
Thank you.
Thank you, Doctor.